every single Jamaican is entitled, as a taxpayer, as a Jamaican, to the best possible health services.
The government's mission of guaranteeing adequate, effective, and efficient public health service in the 2025-2026 fiscal year is being supported by an allocation of over $165.82 billion. Most of this, $155.64 billion, is allocated for recurrent expenses, inclusive of budgetary support to the Bellevue Hospital, government chemist, and the National Council on Drug Abuse. The Health Ministry will offset that with $650 million earned from fees collected. And over $10.18 billion of the total monies allocated is for capital projects supported by the government and/or its international partners. A significant portion of the ministry's recurrent budget is to ensure the 23 hospitals, 336 health centers, and specialized institutions in the 4 regional health authority areas are equipped to deliver first-rate service to Jamaicans. This includes operational support for the National Public Health Lab, the Blood Transfusion Services, and Immunology Unit. The allocation also covers work to maintain health standards and regulations, procure pharmaceutical and medical supplies, carry out rehabilitation and maintenance work, and provide regional health system support. $12.56 billion is also set aside to cover approximately 68% of the operating cost of the University Hospital of the West Indies, and over $13 billion is for the overall administrative services and regulatory expenses of the ministry. The $10 billion allocation for capital spending in the new fiscal year will allow work to proceed on several major health improvement projects jointly funded by the government and its multilateral or bilateral partners. Among them, continued progress towards completion of the Western Children and Adolescent Hospital and redevelopment of the Cornwall Regional Hospital.
In 2024, we launched the final phase, phase 3 of the project, that is to realize the full rehabilitation of the building. By April of 2025, the Medical Records Department, the general stores, the dietary department, and the server rooms will be fully rehabilitated and operational. The next section of the building to be rehabilitated is the Accident and Emergency Unit that we hope to be fully equipped with new CT and MRI machines as a brand new amenity to support the work of the staff of the A&Es.
Construction of the new Western Children and Adolescent Hospital is also at the final stage. This year's targets include completing the cladding of the building and procuring additional equipment to outfit the hospital.
At that location, there will be 800 beds in 2 towers, one 8th floor, one 10th. And every single piece of equipment will be new in that facility, making it the highest concentration of hospital beds anywhere in the Caribbean.
The next capital project will see over $270 million being spent towards the modernization of the University Hospital of the West Indies. Targets for the new fiscal year include engaging an architect to modify designs of the building, as well as a commissioning agent and FIDIC engineer. Requisite municipality approvals will also be obtained so the project can go to market for construction works. The fourth capital development project is for the prevention and care management of non-communicable diseases (NCDs) with a $4 billion allocation.
The importance of preventative action, such as regular screening for the risk factors of NCDs, is underscored by the significantly high cost of treating non-communicable diseases. It is always cheaper to prevent than to cure. And in turn, it's from all aspects, from the quality of life, time with family, time to relax, as well as the economics of working and productivity and output, which is why we have to encourage more screening.
As part of this project, Construction works will continue on the Spanish Town Hospital, which should reach 35% completion during the fiscal year. Construction works will also continue on the St. Jago Park, Greater Portmore, and Old Harbour Health Centres. The budgeted spend also involves completing designs for another 4 health facilities: St. Anne's Bay, Maypen West, Mucko, and the St. Anne's Bay Regional Health Centres, as well as commencing the procurement of civil works on the Ocherius, Maypen, and Brownstown Health Centres. The 2025-26 expenditure also targets completing the installation of managed network services at 50 sites.
So what we're doing really is ushering in the electronic health record system, which for us represents a major transformation in how we treat our patients, our customers in our public health system. Because effectively, it impacts transaction time, the length of time it takes to get a patient through the system, processing them, looking at their historical record, making an early diagnosis, doing a diagnostic test, transmitting that information electronically.
As part of the Prevention and Care Management of Non-Communicable Diseases (NCDs) program, government will also commence and complete health field testing at 5 health centers and start and complete data collection for the Jamaica Lifestyle Survey 4. These are just some of the ways in which the Ministry of Health and Wellness will be investing in the well-being of Jamaicans for 2025-26.